Hey, what's up? This is Dr. Lee. I'm here with Dr. Chris and Dr. Sean, and today we're going to be talking about concussion because this is the symptom of the month this month, and it's something that we see a lot of, and it's been in the news a lot the past 5-7 years as more research and attention has been shifted towards this. And it's actually something that we have a lot of success helping people that have had concussions or post-concussion syndrome. So what we're going to do is we're going to roundtable this, and we're actually going to discuss the different things that are important for you to know if you have had a concussion or you have family members or kids who are playing sports that have had concussions. Because if you don't tackle this right, then you're really setting yourself up for potential serious issues and complications in the long run. So Dr. Sean, you've had a lot of experience with post-concussion syndrome and traumatic brain injury. So I wanted you to kind of kick it off. What are some of the mild symptoms and the more common symptoms, I would say, that people experience when they've had a concussion?
Yeah, that's a great question. So a lot of people after a head injury, a mild one, they can tend to have visual issues, like their vision can get blurry. Sometimes you'll even see double vision. They may have sensitivity to motion, things moving in their field of vision. They'll tend to have a lot of issues with balance as well. And then some people get really sensitive. They can get overstimulated easily, so loud noises, bright lights can be really challenging for them. Super common to have headaches, neck pain, other body pains as well is a big common one. And then cognition gets to be impacted as well. They may feel like some brain fog, difficulty with their focus and concentration. Sometimes memory can be challenged as well.
Yeah, so those are a lot of different diverse symptoms. Now, what are some things that people can be doing instantly, like after you've had the concussion, you know you had a concussion before or even after you've sought medical care? What are some of the things that people can be doing at home in order to avoid exacerbating this and to be able to heal the fastest?
Of course, time is of the essence. We really want to get on top of it sooner than later. But at home, you know, it's not always what everyone said, black and white. You don't want to go to dark rooms and things like that. You do want stimulus, but you don't want to do high impact, high intensity type of things right away.
So that's new, because I know when I was even in chiropractic college back in like 2010, 11, they were talking about you want to go into a dark room.
Yeah.
So this is different. So this is the newer research that's out there right now, is that that's not as ideal. So the recoveries are actually slower if you're in a dark room.
Yeah, and Dr. Sean and I were talking about this beforehand, and whenever you get that high stimulus, it can overstimulate, and that's another big part of, we'll get into this in a little bit, but the adjustment, how much stimulation we get into that as well. Whenever we're correcting these type of things, overstimulus can actually alter the healing process during this time. So you still want stimulation, but you don't want to overdo it, but you don't want to go into a dark room and not get any at all.
Gotcha. And other things, other stimuli can be like, I think you were talking about this earlier, going out to, say if you're a student, you know, you're going into class, having to study. That can be too much, because now you're putting a lot excess stress on your brain. If you're already having blurry vision, you're having headaches, and now you're being forced to read, that's actually really, really challenging on the brain. Is that correct?
Yeah, it can be for people after concussion. You know, if they go into these settings and they start seeing that some of those symptoms get exacerbated or just get a lot worse, that could actually be too much of that stimulation. Other things that people could do to help with that is maybe they wear sunglasses, or some earplugs can help decrease some of that stimulation sensitivity while their brain and their spine and their body are healing during that phase. But yeah, that's the big one you got to watch for, is if you jump back into your daily activities and you're just feeling tanked afterwards, it's too much. You got to dial it back a bit.
Yeah, gotcha. So one of the things that's interesting is like, why are we as chiropractors talking about this? We're talking about this because we actually see very good results with post-concussion syndrome, people that have had concussions and they're trying to rehab their way back into normalcy. And the reason is because the brain and the neck, when you're dealing with concussion, are basically one and the same. Because your head is kind of like a bowling ball that sits on top of your neck, but it doesn't sit directly on it like this, right? Your head doesn't look like that. It's actually at an angle. So anytime that you get hit, which is usually what happens with concussion, or you fall and hit your head, it's always a glancing blow that actually twists. So even if you're almost dead on, what happens is it'll still twist the head, and look what that does to the neck and what that does to the spine. It actually causes a ringing effect. So it's like taking a towel and wringing that towel out. What happens is that's the spinal cord. The towel is the spinal cord. So all the little sensitive nerve fibers that are deep in the middle of the towel of the spinal cord are the ones that get most impacted. And those are the ones that deal with vestibular system.
Yep. Your balance.
What else?
Your visual system and your spinal system, your spinal stability.
And what do people usually think about chiropractic for?
Pain in the low back or pain in the neck.
But the spine, you're getting off track there. The spine, right? We're talking about the spine itself. So what happens is with a whiplash, is there a difference between a whiplash and a concussion based on the research nowadays?
No,
not as much.
No, they're really looking at them as the same injury now.
Crazy, right? So whiplash, which is car accident cases when your head gets like whipped forward, extended back because of an impact, you get stopped really quickly. That's throwing your neck forward, and we've known for years that that's causing a concussion. But interesting, the concussion is also the same as a whiplash injury. You can't isolate one from the other. So chiropractic has been known for decades on top of decades with car accidents, being able to get people rehabbed very, very quickly and effectively to allow everything to heal appropriately. And a lot of those effects that are benefits are the concussion benefits that come alongside whiplash injury. So it's no surprise that when people are coming in with primary concussion type symptoms, that the adjustments that we're doing in the process of correcting the spine is so important. And is this something that you just go in and a big old manual adjustment is going to be the best thing for it?
Not in our experience. So that's why we actually do the technique that we do, lighter adjustments, lighter force. This actually stimulates the nervous system at the pace that we actually need them to heal at. Whenever we go in and throw that bone right back into place, it's too much.
Why can't we do that with someone who just had a concussion or a whiplash type of an injury? Why can't you just go in there and just rack it back and crack it back into place?
Like we talked about, overstimulus. It's too much for the body to take in at that time, and the body doesn't heal as efficiently whenever we do that. So whenever we come in with the lighter technique or the lighter force, we're able to stimulate right where we want to, open those things up, get things healing very specifically at that point where it's damaged.
Gotcha. And the other thing that you actually just talked about a little bit ago that was off camera was the ligamentous damage that happens. Ligamentous damage, that's a big fancy word, but basically the bones have tape on them. They're ligaments that are holding, it's like duct tape that's holding all the bones in place. And when you've been in a whiplash injury, what happens is that tape gets stretched, it gets overstretched. And that allows the bones and the joints to have way too much motion because the stabilizing tape is no longer there. So your muscles go into spasm, you have inflammation that's there to kind of lock everything down. And if you go through and you take those joints and you just go, you just like rip through it, which can be fine in most cases, but in concussion cases and whiplash cases, that's often something that is actually can be very detrimental.
Yeah.
Right? Very detrimental to the spine because it's more than the body can handle. It's that overload in a way that is more than the body can handle. And I've heard of people that have thrown up after they've had adjustments and stuff. So you want to make sure you go to a person who is very capable of handling these cases and has a technique that they can really dial it down, because even with the tool that we use, the torque release technique tool, or the integrator, what it does is it puts in that very small impulse, right? And I know you've had cases where you were just telling me, what did you have to do? That was actually a little bit too much.
Yeah, even on that, we have to back down. So we can back down the power if we need to, but we have to gauge it and see where the patient's at and meet them where they're at.
Yeah, so this is one of those things that can be very hypersensitive. So we wanted to kind of give you and bring you kind of up to speed with concussion, and it's so important that you guys get checked ASAP for this. Don't let this go on, because if it does go on, what are some of the things that can start to occur?
Your symptoms can get worse. You may end up to the point where you're just not able to function and do your daily activities, and the longer that it goes, a lot of times they say most of these symptoms will go away in a month, all right? People that they don't go away in a month, a lot of times these symptoms retain for a long time, even lifetime. Like they just don't go away if they don't go away in a month. So the sooner you get on top of this, the better off things are for you, and you reduce your chances of these symptoms staying around longer.
Yeah, and when it comes to brain stuff, that is not something that I personally am willing to take a chance on. And I know a lot of parents that I talk to, like once they learn about this, then their kids have had a concussion, they are also, you know, they're like, no, this is not something that we're gonna play games with right now, even if there's a chance that this can be something that progresses for a lifetime. And unfortunately, we see a lot of those cases. You know, we don't always see the best, you know, case scenarios where people take, you know, bring them in right off the bat. We're trying to help people repair from, you know, a concussion that they had maybe years ago, and that can be challenging. It's a lot better to be able to get it when it's fresh, so that we can do the best, have the best possible healing, so that it doesn't develop these long-term impacts. So that's our call to action for you, to send this video to anybody you know who has concussion, or someone who just recently had a concussion, or keep this video handy, because it's something that's so important that you and your family or your kids or your friends who had a concussion gets checked ASAP, and you don't kick the can down the road, because the faster you get on top of this, the faster you can start to experience the benefits, and you're much less likely to have long-term lasting effects from the concussion. So thanks for paying attention and tuning in with us, and we'll see you in the next video.